helping to make your life easier. Local every day.
If you experience an itchy mouth after eating raw fruit, vegetables, or nuts, you could have pollen allergy syndrome. Dr. Rob Shaleski with Allergy, Asthma and Immunology Associates, PC, is here to tell us more about it. Nice to see you today, Doctor.
Good to see you. Thanks for having me.
So what is this syndrome exactly?
So pollen food allergy syndrome is a condition where it's kind of a localized allergic reaction, usually in the mouth, the throat, the tongue, to various raw fruits, vegetables, sometimes nuts. And what ends up happening is people that are allergic to pollens in the environment, their body kind of gets tricked because the proteins in the pollens are so similar to the proteins in the foods. So their body thinks they're eating pollens rather than the foods.
What kind of things would you be eating, like in particular?
So depending on the season, for birch pollen, so that's tree pollen in the springtime, usually apples. Sometimes for ragweed, we have things like banana or melons. There's even various nuts, different grains and things like that. A little bit less common. But
Can this happen at any age, or do you see it more in kids?
it can happen at any age.
Okay.
Yep, and then a lot of people that have pollen allergy generally will experience these symptoms.
And they might develop it later in life too?
It certainly can. Yep.
Wow, okay. So how would it be diagnosed if someone ate something like this? Would they know to go see you?
Yeah, so a lot of people come in and they suspect that they have some sort of food allergy based off of their symptoms, and we'll do allergy testing, and if they're allergic to the pollens in the environment and then they've got these symptoms, then we can make a pretty good diagnosis that that's pollen food allergy syndrome.
Can it be serious or not really?
It actually can. Less than 10% of the time there's going to be a systemic reaction or anaphylaxis associated with it, but it's pretty uncommon.
Okay.
And a lot of times we do recommend testing to those particular foods as well to see if that risk is higher in those patients.
So what kind of steps can people take to maybe eliminate or decrease their symptoms?
So a lot of times with this, it's the raw fruit or the raw vegetable, and so peeling it or cooking it or baking it is actually going to remove that protein. When you bake it or cook it, it's going to break the protein down, so your body doesn't recognize it as a problem anymore. It doesn't recognize it as the pollen that you're allergic to.
Mm-hmm.
Some people take antihistamines to help, and even allergy shots for pollen allergy can decrease these symptoms too.
Okay, again, so if you eat something like this, what would be your initial symptom?
It would be pretty immediate onset, mouth itching, tongue itching, sometimes a little bit of swelling, sensation of throat swelling too.
Okay, and then what would you do right after that? Drink some water?
So antihistamines, generally it's advisable to not eat the food at least until you get evaluated.
All right, doctor, good to know, thank you.
Yep.
And for more information on Allergy, Asthma and Immunology Associates, PC, go to 1011now.com.